All right, let's talk about those booster shots. I guess, the first thing is, how is this rollout going for people who want to get a booster shot that had Pfizer as their, first 2 doses?
So it's been an interesting few days to see how the federal government and New York State Department of Health have rolled out the information regarding to the Pfizer booster. So let's be clear. The booster right now are for recipients of the Pfizer primary series. So that would be a 2-dose series for people 12 and older, or a 3-dose series for those who are immunocompromised. The booster is meant to take the level of immunity that we expected from that dosage, which is substantially waned over time, and bring it back to a level that will keep you healthy and out of the hospital. No vaccine is perfect, right? We know that, but we do know that even the primary series remains highly effective against hospitalization and death. What we're seeing now, however, is a increase in the number of breakthrough infections for people who received that vaccine 6 to 8 months ago. So the idea is to provide the booster now before we start to see a rise in hospitalizations and preventable deaths.
How do I know if my job qualifies me to get a booster?
So there is information on the New York State Department of Health website, as well as the New York City Department of Health, and Northwell and other institutions that participate in the vaccine effort have all posted information that we've gotten from those sources. If you are essentially a frontline, either healthcare worker, or as you mentioned earlier, a sort of patient or person-facing job, you work in law enforcement, first responders, people providing food services, it is likely that you qualify. I suggest you go to the Department of Health website and check. I do expect that in the upcoming weeks, that criteria will be loosened and more people will become eligible. We learned early in the pandemic that waiting to vaccinate really led to an increased number of hospitalizations and deaths. This booster is part of an expected course in any vaccination to maintain immunity until we sort of get the forest fire under control.
Is the biggest challenge still vaccinating those who haven't gotten that first shot?
Certainly, that's a really important point, Elizabeth. We can keep those who are already primarily vaccinated. I'm confident we can keep them safer by giving them these boosters. But what that does not take away from is the underlying importance of vaccinating a huge percentage of the population that's yet to be vaccinated. And there are consequences to this. We know that the number of people who are hospitalized, I think it's greater than 90% of all hospitalizations and greater than 92% of all ICU admissions are those who are unvaccinated. So what we're seeing are deaths in even younger people who are unvaccinated. And there are heartbreaking stories in the media every day of people who are on their sort of deathbed are saying, I wish I got that vaccine. We want to stop that from happening. So if you have not yet been vaccinated, we really encourage you to get out there, roll up your sleeve, and do this.